Men who have sex with men is also another risk factor. IV drug use is another risk factor. Born in an endemic region, family history of hepatitis B virus or cirrhosis or hepatocellular carcinoma, or if the patient lives with somebody who is infected with hepatitis B virus. These are all risk factors in the patient's past medical history, which gives you a clue that the patient most likely has hepatitis B virus. So, physical examination findings, these are uncommon, which includes the ascites or jaundice or hepatosplenomegaly. These are very uncommon to find in hepatitis B virus. This is a picture of the hepatitis B virus with its antigens. I want you guys to know from this that hepatitis B virus requires an enzyme called DNA polymerase enzyme in order to replicate. Okay. The mode of transmission, as we said, this is either blood or sexually transmitted. The next one is the hepatitis C virus. Hepatitis C virus, okay? Hepatitis C virus is a RNA enveloped virus that has a positive single strand. It has a positive single-stranded RNA virus, okay? This also can cause chronic inflammation or cirrhosis, or it can also cause hepatocellular carcinoma. Okay. Hepatitis C virus can cause an acute illness characterized by fatigue, arthralgia, which means joint pain and jaundice. Joint pain and jaundice. Okay. Remember, hepatitis C virus is the one that's it can be acquired post transfusion, which means it can be acquired through needle. You know, you can contact a needle that's contaminated, and then you know, it touches the healthcare worker, and they can get it that way. Okay. Hepatitis C virus can also be transmitted by exposure to blood and basically unsafe healthcare procedures like injection procedures. Okay. So accidental blood contact. Okay. Remember, this one can also be transmitted vertically. Perinatal vertical transmission from an infected mother to the fetus. Just like hepatitis B virus, it can also be transmitted vertically from the mother to the fetus.
I have a question.
Yeah.
So if it doesn't get transmitted through the placenta, can it still be transmitted through birth?
This one also gets transmitted through the placenta, and it can also be transmitted during birth as well.
Okay.
Same thing with hepatitis C and B, both of them can get transmitted during birth. Correct. And through the placenta. Good question. Now, risk factors for a patient to acquire hepatitis C virus. Okay. Most important risk factor is unsafe medical practices, IV drug use blood transfusion or organ transplant, and birth between 45 and 65, because when people used to get blood transfusion between those years, they did not screen the blood for hepatitis C virus. And those medical practices were not acquired until after 65. Okay. So a lot of people got infected that way because we didn't know that we transmitted that way. Finally, we have table, which basically summarizes everything. Here, it gives you a classification of the family. I'm not gonna test you guys on which family they belong to. I did that before, but I'm not gonna do that this time. The only thing that I do want to add is about hepatitis D virus, the hepatitis D virus. This is considered a defective. It's a defective RNA virus. It's a defective RNA virus. Why is it considered defective RNA virus? Because it requires hepatitis B virus in order to replicate. It requires hepatitis B virus in order to replicate, which is why this can cause a co-infection with hepatitis B virus. And if that co-infection happens, then the presentation is very, very serious, very serious. So also this can cause a superinfection. A superinfection basically means that you have a patient who's already infected with hepatitis B virus, and then after that, on top of being infected with hepatitis B virus, gets infected with hepatitis D virus as well. So there's a difference between superinfection and co-infection. Superinfection, first hepatitis B happens and then D comes. Co-infection, they're both happening. They infect the patient simultaneously at the same time. Okay. Any questions here? Okay. I'm gonna just give me a second so I can open up the second one. So part 4 of chapter 13. And part 4 deals with childhood exanthems. And these are childhood exanthems. These are rashes seen. These are rashes that are associated with virus infections seen in the basically pediatric population, most commonly the pediatric population. Okay, so let's go over these.